Today is the first breath of tomorrow, the springboard for all that will come. Right here, near where you are right now, health and health care changed forever. The first open-heart surgery is done. The first transistorized portable pacemaker is invented. The first pancreas transplant. The first successful bone marrow transplant. The Minnesota 12-step model for addressing addiction. Cortisone, Zyogen, MMPI. The bileaflet mechanical heart valve. The term health maintenance organization is coined. The first in-the-ear hearing aid is created. Rollerblades, the Nordic Track, and Minute Clinic. Sliced bread was invented elsewhere, but the pop-up toaster was invented here. The Nerf ball, and the supercomputer. Milk is fortified with vitamin D. Dr. Norman Borlaug wins the Nobel Peace Prize for his efforts to improve wheat varieties and introduces them around the world. And the Mayo brothers launch a clinic that will advance the delivery of healthcare in countless ways. Each step is meaningful alone, but together, we've taken 1 million steps, changing the world forever. The next advance in nutrition, in strengthening health, in creating consumer connections, in leveraging retail to empower wellness, may be in this room. Ideas are everywhere. Passion is the thing, and the path. Health is the greatest gift, says Buddha. It is health that is the real wealth, Gandhi reminds us, not pieces of gold or silver. We live in a bold new world of disruptive change, where innovation can be shared at the speed of a click. Today is the moment tomorrow begins. We're moving from narrow lanes and vertical categories defined by condition or disease, product or service, to a more expansive view of health. A view that begins with the individual, that includes social networks, that extends to the influences in our lives, and the communities we share. Health defines us, what we do, what we can do. New technologies, new engagement tools will fuel our steps forward. New retail platforms will connect us. Empowered consumers will challenge and reshape expectations for accessibility, affordability, transparency, and customization. Manova, the global summit on the future of health, seeks to advance innovation, technology, leadership, and compassion in ways unmatched. Because the world is ready for the next generation, for the innovation that will take us into the future, improving the lives of every human being, regardless of context or circumstance. What begins here can change the world.
Ladies and gentlemen, welcome to Manova. Please join me in welcoming the chair of the inaugural Manova Global Summit on the Future of Health, 2023 Partners CEO, Mark Addicks.
Thank you. Thank you very much. Welcome to Manova. We are so thrilled you are here, and I want to thank you for being first. This is our first inaugural summit on the future of health. And the fact that you're here tells me that you're a person that leans forward. You want to hear ideas the first time. You want to be first in so many ways. And we have a great summit planned for you. We have over 100 incredible world-class speakers that are going to start in just a minute, and we're jam-packed. We're going to go fast so that we deserve and can command your attention and your thought and your brain power and your heart. So this is going to be a great focus summit on the future of health and improving the health of everyone on this planet. We have designed Manova to be different in 3 critical ways. The first one is global. Whether you hear conversations today, tomorrow, or Wednesday about Mumbai or Minneapolis or Manchester, it may be local, But what we're going to ask ourselves, and I hope you are constantly thinking about, is how do we make this idea better? How do we make this idea bigger? How might we take this idea and actually have a global footprint and impact on the world? Because you could see from the opening video, we have had a global impact, and this is about looking forward and truly having the next level of global impact. Second, we're going to be focused on the future, not where we are, but where we're going together. Not what we have today, but what will be. So keep a focus, and our focus is going to be the next 3, 5, and 10 years. The third thing that is really the core of why Manova came together is innovation. You saw our legacy of innovation, but we need to do a reboot. The world is waiting for you and for us to really rethink with an expanded definition of health, way before you get to healthcare, to healthy individuals, healthy communities, all the way through important elements of care, that we rethink and innovate, and that we come together to really move health forward. Manova is started because we are right at the precipice of a huge change in all things health. We're moving from a B2B model, we're moving to a consumer model, empowered consumers, empowered by technology, new forms of engagement, new forms of retail. We should start today, and for the next 3 days, have a bigger conversation of all the ways we can impact positively people's lives. We've designed the program, and you've seen it, and I am so humbled and honored. We have over 100 people coming from around the world, and some of these people were reaches for us, but they agreed to come because of who we are and where we are, right here in Medical Alley. And we've designed the program not to just throw speakers at you, but to curate a conversation, and hopefully you'll see that. We want you to think differently, and you're going to see different things. Before we talk about just what you eat and how much you exercise, you're going to hear about the sleep revolution and why that's so important. You're going to hear a lot about artificial intelligence and big data and how that might link to your personal genome for the operating room of the future. You're going to hear about social determinants of health. You're going to hear a lot about that topic and how where we live, how we live, really has a major effect, not just on us, but the people in our immediate unit and our broader networks. You're going to hear about hospital care and care in general, reimagined, reframed. You're going to hear about health plans, but a different kind of health plans that are really customized down to the individual, down to how they live, that will be flexible and really well thought out. And you're going to hear about brands. As we go to consumers, how do you build a health brand? How do you build a brand that people are going to truly trust in this world where they don't trust a lot of institutions? And finally, one of the really different things about Manova, and it starts with some of our speakers today, is we're going to show you a lot of places in the world that are resource constrained, that are doing incredibly innovative things. And what we want to ask ourselves is, look at what they're doing with so little, and why are we bringing that innovation quickly forward to a place where we have so much and our costs are so high? And vice versa, how do we take what we are doing and boil it down to essentials, boil it down to primary premium health delivery in places that really need it in the most remote corners of the world? The perennial themes that will be throughout this will be things we should all be concerned about when we talk about the future of health on the globe. Accessibility, affordability, transparency, and customization down to the patient, down to the individual. These are perennial themes, and it doesn't matter what the context is, we will address it all throughout the next 3 days. My hope, my real hope, and the reason so many of us have put so many hours in pulling this together in like the last 4 months, is we want an action step to come out of the next 3 days. We want you to see something different, frame it different, and ask yourself, so what are we going to do? What is your team going to do? We want you to meet people here, funders, partners, other resources. We want you to network, and we want you to come out of this summit with a action step, something to do differently, maybe something you didn't imagine, maybe with somebody who's sitting next to you or across this room who you've never met. That's our goal. So thank you for being at Manova. This will be a platform for those big things that sometimes we never stop to really ask, how might we do it? A platform for true innovation. So I really want to thank you for being here. I want to keep us on time because this is a train that's going to go really, really fast. And that's how we're going to all just take it in. And now I'm going to pivot to a real partner. Literally 4 months ago, this was basically all on a notepad, what you're seeing today. One of our first early partners was Medical Alley Association, and I want to bring forward their executive director. They, in the true spirit of Manova, all they saw were dribblings on a pad, and they said, we want to be in with our list of companies and associations. We want to be in for Minnesota, and we want to be in for this place called Medical Alley. So please welcome Shaye Mandle. Thank you.
Welcome. From Manova founding partner, the president of Medical Alley, Shaye Mandle.
I want to welcome you to the first edition of Manova. As Mark mentioned, the goal of Manova is to be the place on an annual basis where leaders from around the world that have an impact on how we care for each other come to network, to share ideas, to show us the newest technologies, to show us the business models that are transforming healthcare. On an annual basis, we'll all come here to lead that conversation. But for the rest of the year, as Mark mentioned, there is work to be done. And there is a call to action today. It is to find those partners. It is to engage in what we'll see next year at Manova and the year after. And for the remainder of the year, I want to pledge that we're the partner at the Medical Alley Association to help you facilitate that. So please, as a follow-up to this event, we'll be working with all of you to ensure that the conversations that are created here today and over the next 2 days will continue throughout the year, that we will help to facilitate those. And when we come back here next year and talk about the future of health, there will be a new future that was found in this event. Again, welcome to Medical Alley. Welcome to Manova. Have a great 3-day conference. We're happy you're here.